Imagine this. You go to your doctor for a routine checkup. You feel fine, healthy, normal. But your doctor looks at your test results and his face goes serious. "I'm sorry," he says. "You have cancer." Your world stops. He tells you it's aggressive, that you need to start chemotherapy immediately, that without treatment you might only have months to live. So you trust him. You start chemo. The poison pumps through your veins, you lose your hair, you vomit constantly, your body breaks down, but you endure it because you're fighting for your life. Except, you never had cancer. Your doctor lied. He diagnosed you with a disease you didn't have, so he could bill your insurance company for treatments you didn't need, and you weren't the only one. He did this to 553 patients for 4 years and made $34 million. This is the true story of Dr. Farid Fata, the oncologist who became one of the most evil criminals in American medical history. Dr. Farid Fata was a respected oncologist in Detroit, Michigan. He ran multiple cancer treatment centers across the state, Michigan Blood and Oncology. Patients came from all over to see him. He had a good reputation. Caring, thorough, aggressive in his treatment approach. When he told you that you had cancer, you believed him. Why wouldn't you? But starting in 2009, Dr. Fata began doing something unthinkable. He started diagnosing healthy patients with cancer when they didn't have it. He would look at their test results, see that everything was normal, and lie. "I'm sorry," he would say. "The tests show cancer." And then he would prescribe chemotherapy, unnecessary, dangerous, poisonous chemotherapy, to patients who were perfectly healthy. Let me tell you about some of his victims. Monica Flagg was 53 years old. She went to Dr. Fata for a routine checkup. He told her she had an aggressive form of leukemia, that she needed chemotherapy immediately. Monica was terrified. She started treatment right away. For 2 years, she received chemotherapy. The drugs destroyed her immune system. She developed infections, heart problems, kidney damage. But she kept going because she thought she was dying of cancer. She never had cancer. Robert Sobieray was 52. Dr. Fata told him he had a rare blood disorder that would turn into leukemia without treatment. Robert trusted him. He started chemotherapy. The treatment made him so sick that he could barely function. He lost his job, his marriage fell apart, his savings were drained paying for medications. He never had cancer. Patty Hester was 60. Dr. Fata diagnosed her with multiple myeloma, a deadly bone marrow cancer. She underwent years of chemotherapy. The drugs were so toxic that her body started shutting down. She developed heart failure. She could barely walk. She was in constant pain. She never had cancer. And there were 550 more just like them, healthy people, told they were dying and poisoned with chemotherapy they didn't need. So why did Dr. Fata do this? Money. Chemotherapy is expensive. A single treatment can cost thousands of dollars. And insurance companies, Medicare, they pay for it. Dr. Fata realized he could make a fortune by prescribing chemotherapy to as many patients as possible. So he started lying. He would take a patient's blood test, see that their white blood cell count was slightly elevated, and diagnose them with leukemia. He would look at a normal bone marrow biopsy and claim it showed cancer. He would tell patients they had aggressive tumors when their scans were completely clear. And then he would prescribe the most expensive treatments possible: chemotherapy, immunotherapy, bone marrow stimulants, drugs that cost tens of thousands of dollars per dose. And he would keep them on these treatments for years. Even when patients started questioning him, even when they said they felt fine, he would insist they needed to continue. "The cancer is still there," he would say. "If you stop now, it will kill you." Between 2009 and 2013, Dr. Fata billed Medicare and private insurance companies for $34 million in fraudulent treatments. $34 million for chemotherapy that his patients didn't need. But in 2013, one of his patients started to get suspicious. Her name was Sneary. Dr. Fata had been treating her for years for what he claimed was a pre-leukemia condition. But Chris didn't feel sick. She felt fine, healthy, normal. And yet, Dr. Fata kept insisting she needed aggressive treatment. So Chris decided to get a second opinion. She went to another oncologist at a different hospital and brought all of her medical records. The new doctor reviewed her test results, and his face went pale. "You don't have cancer," he said. "You don't have pre-leukemia. You don't have anything. Your blood work is completely normal." Chris was stunned. She had been receiving chemotherapy for years for a disease she didn't have. She immediately reported Dr. Fata to the authorities. The FBI launched an investigation. They subpoenaed Dr. Fata's medical records. They interviewed his patients. They reviewed thousands of test results and treatment plans. And what they found was horrifying. Out of 1,200 patients that Dr. Fata had treated, 553 of them had been misdiagnosed. 553 people had received chemotherapy first radiation, immunotherapy, for cancers they didn't have. Some of them had been in treatment for years. Some of them had suffered permanent organ damage from the unnecessary drugs. And some of them had died, not from cancer, from the treatment. In August 2013, the FBI arrested Dr. Farid Fata. He was charged with healthcare fraud, conspiracy, and money laundering. Dr. Fata's trial began in 2015. Prosecutors presented overwhelming evidence: medical records, billing statements, testimony from patients who had been poisoned with unnecessary chemotherapy. One by one, his victims took the stand. Monica Flagg testified about the 2 years of chemotherapy that destroyed her immune system. Robert Sobieray testified about losing his job, his marriage, and his savings. Hester testified about the heart failure caused by drugs she never needed. And there were dozens more. People who had trusted their doctor and been betrayed in the worst possible way. Dr. Fata's defense tried to argue that he had made honest mistakes, that he had genuinely believed his patients needed treatment. But the evidence was too clear. He had deliberately falsified test results. He had prescribed treatments he knew were unnecessary. He had lied to patients for years, all to maximize his profits. In September 2015, Dr. Farid Fata pleaded guilty to 16 counts of healthcare fraud and conspiracy. At his sentencing hearing, the judge called him the most egregious fraudster she had ever seen. She sentenced him to 45 years in federal prison. He will be 90 years old when he's eligible for release. But the damage was already done. 553 people had been poisoned with chemotherapy they didn't need. Many of them suffered permanent health problems: heart disease, kidney failure, immune system disorders. Some of them died from the side effects of the treatment. And all of them had to live with the psychological trauma of being told they had cancer when they didn't. The financial damage was catastrophic. Families had drained their savings paying for medications. People had lost their jobs because they were too sick to work. Insurance companies had paid out millions for fraudulent treatments. Dr. Fata was ordered to pay $17.6 million in restitution to his victims. But no amount of money could undo what he had done. So what can we learn from this case? First, always get a second opinion. If a doctor diagnoses you with a serious illness, especially cancer, see another doctor. Get your test results reviewed by an independent specialist. Sneary saved herself by doing exactly that. Second, ask questions. If your doctor prescribes aggressive treatment, ask why. Ask to see your test results. Ask what would happen if you waited. Don't just accept a diagnosis without understanding it. Third, trust your instincts. If something feels wrong, if you don't feel as sick as your doctor says you are, speak up. Advocate for yourself. And finally, remember that doctors are human. Most of them are honest and caring, but some of them, like Dr. Fata, are motivated by greed, and they will hurt you to make money. Dr. Farid Fata is currently serving his 45-year sentence at a federal prison in Ohio. He will likely die in prison. His medical license was permanently revoked. He can never practice medicine again, but the damage he caused will last forever. 553 people were poisoned with chemotherapy they didn't need. Some of them are still dealing with the health consequences today. And all of them have to live with the knowledge that their doctor, the person they trusted most, betrayed them in the worst possible way. This is one of the most horrifying cases of medical malpractice in American history. And it's a reminder that we must always be vigilant about our own healthcare. Because sometimes, the person who's supposed to heal you is the one who's hurting you. If you found this story valuable, please subscribe to this channel. I cover a new case of medical malpractice every week. And if you or someone you know is about to start cancer treatment, share this video with them. It could save their life. Thank you for watching.